roughly 20% of people have persistent pain after a knee replacement. So after somebody's had a good surgery, they get bad outcomes. And a lot of times it has to do with the rehab. There is a number one reason why PT clinics don't get good rehabs done. And we're gonna make sure in this video that doesn't happen to you. There's 4 major phases to recovery. There's the early phase, the intermediate phase, the late phase, and then the full recovery phase. In the early phase, it's the first 1 to 6 weeks. That should be spent with the physical therapist. And then you get into the intermediate phase. So after those first 6 weeks, your bone is still healing, but you should be able to do normal activities like walking, sleeping without pain, sitting for longer periods of time. That's what our target is for the first 6 weeks, really by week 4 if you were here at our clinic. But then after 6 weeks is when we have the cutoff of that early phase. Then we get to the intermediate phase, and that's week 7 through 12. Your bone is still healing, and we want to make sure that we get that continued healing. And so we don't want to do too much, but we want to get back to a normal level of activity, moving around, normal activities of daily living. That later phase is at 3 months to 6 months. We're still having remodeling in the bone, but we're actually working on strengthening and getting back to all of our normal activities, low impact exercise, and really challenging the body. And then in that full recovery phase, that's 6 to 12 months. Like, we're continuing to heal throughout that process. We should have full bone healing and be able to get back to higher level functional activities. Some of the times doctors don't want you to play pickleball or play any sports again because you have a prosthesis pushing up against a bone. But a lot of our clients get back to those activities. They're not low impact, but they're also not crazy. They're not running long distance. They're not doing marathons, but they are having to shift from side to side and make some pretty high level movements. And they get back to that in that 6 to 12 month range where they're doing full activity and starting to play lower impact sports. So we want to make sure that you understand exactly what the downside of going to a bad PT place is, and I'm going to show you right now. Post-surgery, the worst thing that you can do is chase flexion. And what happens a lot of times is that people come straight out of school and they start doing rehab and they're chasing flexion and extension at the same time. And what we've seen, we've had clients that came in 6 months post-op, 9 months post-op, and they're still having pain. They're still having massive inflammation in their knee, and we have to clean that up. That's a big problem for us. And one of the major things, bad problems that they do, bad exercises, is that the PT will have them go up against a wall. They put this ball up against the wall, and then they'll push their knees into it. So they're grinding into their knees into the wall, trying to chase flexion. They're putting a ton of pressure on their kneecaps. They're putting a ton of pressure on their knees. They're chasing flexion in a really bad way, and that's what causes them the biggest problems. So the top 3 reasons why we have chronic problems and chronic pain is repeated movements, prolonged postures, and then accidents and trauma. So you have an accident, it's a trauma when you have a surgery. We've got to be able to change the repeated movements and the prolonged posture. So the way that we sit, the way that we walk, we need to change those things because there's a reason that we had to have that knee replaced in the first place. If it's a major trauma, an old sports injury, but a lot of times it's just wear and tear. And so that wear and tear has to be changed if we want to have a full recovery. The worst thing to do was that knee flexion into the ball. The number one thing that we need to be doing is working on extension. And that's extending the knee, getting it straight at 0 degrees where it gets completely straight because it comes down to triple extension. So in the first 2 weeks of rehab, when you're going to a physical therapy place, if you're doing it at home, the first 2 weeks, we have to get that knee fully straight. If this doesn't get fully straight, then when we walk, we get triple extension. So when I'm walking, I'm pushing off of my foot. That's plantar flexion, but it's extension at the ankle. So I'm pushing off of my foot, I'm pushing off of my knee, and I'm pushing off with my hip. But when I'm walking, we call this mid stance, where I walk here and my knee gets totally straight and I unload the knee. It doesn't put pressure on the knee, and then it bends, and then I push off of my ankle. If I don't get to full extension right here, then my knee is staying bent all the time, and that's causing more inflammation. That's actually gonna slow down your ability to get more flexion worse than if it gets straight. So we have to chase full extension. First 2 weeks, everything is all about getting this quad fired up and getting full extension. So we've got to get full extension. We can take pressure off of the knee, and then your flexion is going to naturally come back, the majority of it, because we're getting rid of inflammation. But then when we get later in those phases, we get weeks 4 to 6, we'll start chasing. If we have a little bit of flexion that we need, we'll start chasing it then. It just makes sense. You get rid of the inflammation, you get rid of aggravating it, the inflammation while you're walking, and then you're able to get more flexion back. So it has to be a stair-step process. It has to be a system-based approach to be able to get a good knee rehab. If you want a deep dive into each phase of rehab that we do with our clients, we can post videos on here. Subscribe to the channel, leave us a comment, let us know if you want to know exactly what we do in the early phase. If you're trying to do this at home, if you're in a different state or a different country and you're trying to get yourself to full recovery, we can do videos on exactly what we do in the early phase, exactly what we do in the intermediate, and then in those later phases, and to get to a full recovery, we'll do a deep dive for you. So just leave a comment and subscribe. After we get full extension, we're taking load off of the knee. We got to fire up 3 different areas of the body. We got to make sure that we're getting quads. They have to be fired up. I have to get these muscles right here to be strong, because after the trauma of the surgery, a lot of times these quads shut down. But that's not the most important thing. It's just the first thing. So we get those quads fired up, they're gonna come back. If you can get to a quality PT and they throw needles into the quad and put electrical stimulation on it, then they can fire up those quads pretty quick. But then we've also got to fire up our glute. My glute keeps my knee from twisting up and from this grinding. So when we look right here on the skeleton, when my glute isn't strong, then this bone twists in and I'm grinding on that knee joint all the time. So that's what we see when people have full extension, they have full flexion after their knee replacement, but they still have pain. It's typically the structures around the knee and the kneecap, those muscles are irritated all the time because we're getting too much twisting. Even though the knee joint is new, there's too much irritation that's happening in the muscles. We're stiff and tight and we need to change that. We change that best by actually firing up the correct muscles. So you've got your quads fired up. Number 2 is making sure that we're gonna be chasing our glutes the entire time. We've got to be able to fire these muscles up. We're really gonna do them at the same time, but it takes more time to get those glutes stronger, because more than likely they weren't very strong before you went into surgery. And that's what's gonna protect your knee, protect your low back, protect your ankles, because this glute muscle wraps around and it's pulling my knee to the side. So I can pull it out here. So every time I take a step, it stays stable. If it's not strong, then the knee twists inward each time and I'm causing that irritation to it. The third thing is making sure that we're getting dorsiflexion, that we're getting bend in our ankle. We've got to make sure that this ankle bends to 10 degrees, because when we're walking, I've got to be able to bend, that ankle has to bend. When the knee gets straight, the ankle has to bend to 10 degrees, then my knee bends, and then I push off of my foot. So we've got to fire up these muscles on the front of our ankle as well, so that we can loosen up the back of the ankle, fire up the muscles on the front of the ankle. So this is a big overview of how we're gonna do the correct rehab and make sure you get the best out of your surgery. And so one of the exercises we'll do is we'll get up against a wall and we'll fire up these muscles coming up. We'll hold it for 5 seconds, then let it slowly lower down. A lot of times people do stretches for the back of the calf. It is good, but it's better to do some stretching, but then also fire up the muscles on the opposite side. That's gonna get reciprocal inhibition. If I squeeze my bicep as hard as I can, my tricep has to be loose. If I fire up the muscles on the front of my leg, then it's gonna help these muscles relax on the back side of the leg. And I'm gonna get more out of it, and I'm gonna get stable dorsiflexion, stable bend in that ankle, and then I can build on that over time. Now remember, the number 1 mistake that people make is that they chase flexion too early and they irritate the knee. They don't chase extension when they should. We've got to chase extension first. And then also after we're getting the quads fired up at the same time as the glutes. And then we have a glutes first approach. So the glutes have to be the strongest muscle in the body, because every time you walk, that quad is firing because we woke it up, but the glutes have to push through as you're walking. So that's the complete approach. So let us know in the comments, let us know exactly what you want us to dive down into next. We'll see you in the next video.